Right. Well, hello and welcome, everyone. We want to thank you for joining us today for this Zomedica-sponsored webinar. Our topic today, we're going to be talking about the treatment of the iliopsoas injuries with manual therapy, shockwave therapy, and a home exercise program. Today's program or presentation, pardon me, is being presented by Dr. Debbie Gross Torraca. Dr. Torraca believes every dog deserves to live the best quality of life for the longest time possible, pain-free, happy, and strong. Her company, Wizard of Paws Physical Rehabilitation for Animals, focuses on that the moment an animal walks in the door, whether they are 8 weeks of age or 18 years of age. Dr. Torraca began her career in human physical therapy and specialized in orthopedics and pain management in both orthopedic and sports medicine atmospheres. Her knowledge and ability to translate her knowledge from the human side to animals. She's been enjoying her work with animals for over 22 years and is considered a pioneer in the field of canine physical rehabilitation. Through the university and throughout the world, Dr. Torraca has been a well-sought-out speaker on a variety of subjects. She speaks all over the world to veterinarian professionals, allied healthcare professionals, dog enthusiasts, and owners. She's also the founder and head the certified canine manual therapy program through the University of Tennessee. She teaches regularly at the Fenzi Dog Sports Academy, as well as many other organizations. Her passions include sports medicine and working dogs, as well as degenerative myelopathy. She focuses on the identification and treatment of pain in all the dogs she works with. Pain is often overlooked in many physical and behavioral issues and may make the difference between success and failure. She sees a variety of clients in her busy clinic focused on rehabilitation and wellness. So without further ado, please join me as we welcome Dr. Deb Torraca.
Thank you so much, Susan, and thank you so much for joining me today. I love the topic of the iliopsoas, and I either think it's overlooked or underlooked, but it is, if you are in the field of small animal rehabilitation, or you're working in general practice, or you're a pet owner, this is something that will definitely benefit you. The iliopsoas is definitely a complicated, I won't say little muscle, a large muscle. And as Susan indicated, so I own Wizard of Paws, and we probably see an iliopsoas issue in 1 out of 5 of the patients we see. And whether it is a primary, a secondary, or tertiary, that remains to be seen. So as I go through this, I'll talk more about that and differential diagnoses and all of that. So when we look at the iliopsoas, and certainly it is 2 muscles come together. We'll have a little anatomy lesson in a moment. But where I see the most problems is the action of slowing down. So a dog chasing a ball, and I know I have a ton of clients that just cannot stop throwing a ball to their dog. And we may blame organized sports or too much activity with these organized sports and creating iliopsoas injuries, but I think a lot of it comes from ball playing. So when that dog is running and stopping short, that iliopsoas has to work eccentrically to slow the dog down. And of course, you know, there's ball throwing, there's frisbee throwing. You may have a dog that fence runs or chases after squirrels, anything repetitive in a similar motion. And when we look at these injuries, so we may not always be seeing them. And by that, I mean, if a dog characteristically pulls up lame in a hind limb, we tend to think cruciate or perhaps even hip. We may not think about soft tissue. And this is important to look at our performance dogs and our very active dogs. So it doesn't have to be a performance dog. It could be a dog that's very active in the backyard. For example, a fence runner or ball chaser, anything like that. And with iliopsoas injuries, as I mentioned, they're increasingly common in both working and athletic dogs. This image of the Malinois is a dog involved in French ring. And I definitely see a lot of soft tissue injuries with protection work, your working dogs, such as your police dogs or your protective dogs. In human sports medicine, we know that acute stretching-induced muscle injuries are estimated to account for about 30% of injuries. When I think about it, the dogs that I see, because I do see a lot of dogs involved in sports medicine and activities, and I would not say that a third of them are diagnosed with soft tissue lesions. That number is starting to come up, I believe, as we learn more and more. So if radiographs look great, but now we want to look a little bit deeper. Is there a soft tissue injury? Is that going on there? So when we look, here's your anatomy lesson. So the iliopsoas is actually two muscles coming together. So we have the component that pulls off L2 through L7. And I'm going to talk a lot about that lumbar component when I address treatment, because I think this is a common mistake, is not treating the lumbar component. And what makes this such a tricky muscle is that we have such a strong origin from L2 through L7. And then, of course, where both the two muscles are coming down, the psoas minor and the psoas major, and with the iliacus coming in to that lesser trochanter. And we do a great job of paying attention to that area, but not always the lumbar component. So whether you're treating with photobiomodulation, Shockwave, adding a CC loop in, manual therapy, mobilization, stretching, massage, whatever your tool is or combination of tools, it'll be important to always address that lumbar component as well as the insertion. And when we look at the action of the muscles, so again, here's some more anatomy for you. But we have that hip component, and the muscle inserts into the hip. It acts as a hip flexor and a hip external rotation. This is why we will, when we look at the iliopsoas, we will test it in hip extension and a little bit of hip internal rotation. So we have that component. So the hip component is that strong hip flexor. Then we have the lumbar component that acts as a pelvic and lumbar stabilizer. When that muscle is restricted or tight, it's going to cause a pull on the lumbar and the pelvic regions into extension or an arched position. And sometimes you'll even see dogs that start to develop a C curve if that area has not been treated. So in combination, when that hip flexes, the lumbar spine should remain in a neutral position. When the hip extends and the iliopsoas is in an elongated position, the lumbar spine should also remain in neutral to prevent the hip from moving further back into extension. So if you read that again, and just picture in your mind how that lumbar component is supposed to stay nice and neutral while the hip is going into these motions. Then think about maybe some of those agony of defeat videos that we see on Instagram or YouTube where the dogs are all over the place. So they go after a ball or a frisbee and they flip or they twist and all of that sort of stuff. So we can see how both components are more prone to injury here. So important to take a look at. And how does an iliopsoas issue present? Well, it can present in a lot of different ways. We'll see a few different cases, both acute and chronic, but certainly history. A soft tissue injury, we want to know, did the dog suddenly pull up lame? Had been absolutely fine, and they went running maybe on a cold day, or they slipped, or I am up in New England right now, and our temperature starts at 40 in the morning, 70 in the afternoon, and back to 40 at night. And the morning and evening are when soft tissue injuries are more apt to happen, both in animals and in people. So, we start to look at what happened, what's going on, the lameness. Are they not pushing off as much? Are they not extending as much? Are they protecting that area? And I'll go through these clinical signs a little bit more, but certainly is hip extension with a little bit of internal rotation painful and or restricted. So often we'll see a loss of hip extension, of certainly pain in the area will be important. Their gait may be off from a complete three-legged lameness to just a reduction in extension. Palpation, most of all of the time, this area will be very tender, both the lumbar component and definitely the insertion into the lesser trochanter. Then we look at function. So if this area hurts, dogs are going to have a tough time jumping up. So maybe back into the SUV, the pickup truck, onto the couch, over a jump in agility, or while they're working, anything like that. With palpation, while palpating the region, I always caution people, be careful, because you may have a dog come in with a cruciate repair and you go to palpate that iliopsoas area and they're tender because they're compensating for the cruciate deficient stifle. So be very careful. This video was actually one of my own dogs that had hip dysplasia, and his bilateral iliopsoas area, the worst hip was the right. He was more painful on the right side. So just to give you a little bit of an indication, while I'm palpating and going in, so finding the rectus femoris, then moving in medially and coming up and in, and you can see that reaction there. And that wasn't too bad, but definitely sore. And this is an area, as I mentioned, just palpating that can cause pain. Some dogs will turn around, try to bite you, but definitely elicit a pain response. So just be cautious when doing this. I do like to do it bilaterally. So I'm feeling the thickness of the muscle, if it's tight, if it's has some suppleness, anything like that there. This was, if you look at the picture on your right, the dog in the show ring. So this was on a Sunday. Border Collie entered in a conformation show. And if you pay attention to the left hind limb, you will see that external rotation, and the right hind limb is under a little bit more. And this was Tuesday. So she came into the office. You can see that she's hopping on that left side, a little bit of a side winding gait. So moving to the right to stay off of that. And I'll play it again so you could see, pick up on it. I wish I did this in slow motion. So there's that little hop there, definitely not extending very well at all. And she, the day before the conformation show, was out herding sheep in the mud. She cleaned up pretty well. And she injured her left iliopsoas. Okay, so a little bit more about the history. And you may hear, especially if it's more of a chronic condition, that the dog has a decreased performance. So maybe in agility or obedience or fly ball, they're not running as fast, or a lot of times in sports, time is such a big deal. So their time may be increasing where we want it to decrease. They may be slipping more. Trouble with knocking bars with jumps. And this is, different sports, but also think about our pets that may have trouble jumping into a car or jumping onto the sofa. They may hesitate because we got that lumbar extension and that hip extension there as well. If they're involved in agility, very often we hear about popping out of the weave poles. In agility, dogs do either 6 weave poles or 12. And Typically, the right hind limb is the last leg to enter. And if they slip, if they're on an unfamiliar surface and they slip out, this may cause an injury. They may avoid slippery floors because they don't feel as secure. Decreased jumping and certainly decreased jumping strength. So when we think about our objective measurements in the clinic, we are going to measure girth measurements. If you have a force plate or a dynamic gait analysis or static gait analysis, we'll look at that. If you look at this German Shepherd's left leg, we'll see that he is not completely weight bearing and he is externally rotating. This is one of our local state police dogs, and they love to throw the ball. And this was an issue that kept coming up. Whenever the handler would slack off on his strengthening, it would creep back up. So he had a chronic left iliopsoas issue. So clinical signs, when we look at this, definitely pain with stretching of the hip into extension and that internal rotation. So maybe limited, you may not be able to get to end range. You may get what's called an empty end feel. So you try to pull back and the, could definitely have had some issues there. Pain with stretching of the hip, just moving that hip. Pain and spasm in the groin region and the lumbar region. So very often muscles are going to go into a spasm to protect the region. And when a muscle spasms, it does not always indicate a musculoskeletal issue. It can certainly indicate something else going on. So it's important to look at that. Clear everything. Lumbar pain as well. As I mentioned, specifically L2 through L7. If it's a right-sided injury, you may see pain and limitation on the right lumbar region from L2 through L7. Oops. And here we go. And the gait and the posture. So typically, as I mentioned, there's decrease in extension. So if you do have a dynamic gait analysis, you'll see that decrease in extension or decrease in reach. Sometimes there's a circumduction or an outward gait pattern. So the dog is not moving in a complete linear fashion. They'll swing that leg out. There'll be decreased power pushing off or a decreased ability to push off. So again, with that jumping or running upstairs, very acute conditions or very chronic, you may see them non-weight bearing or partial weight bearing. And as with that shepherd, we can just see that he did not have all that weight onto the left leg. Certainly some other areas to consider: stifle disease. Very often a cruciate deficient stifle will see compensations. And the iliopsoas may just be a secondary or tertiary issue. So it's important to take a look at that. I've had a lot of dogs referred in with iliopsoas issues, and it's been a partial cruciate tear. And certainly their iliopsoas area is restricted and it's causing pain. However, the primary problem is the cruciate deficient stifle. Hip dysplasia. A lot of the muscles are going to compensate. So they are going to tighten around the area. As you saw with my own dog, with the hip dysplasia, he compensated a great deal with his hip flexors, just in a protective stance. If the dog has a transitional lumbar vertebrae, so this is L7, it's missing the transverse vertebrae, sorry, my thinking here. And so that area is going to have a little bit of a C curve. So that's going to cause a tightness in the area, and this can cause some restrictions in the iliopsoas. Dogs with lumbosacral stenosis, same thing. Their pelvic area is going to be in a flex position. So this is going to biomechanically shorten the iliopsoas. Also, if dogs have internal issues, so bloating, anything, kidney disease, things that, again, are not rehab specific, but that we need to consider. So it's important to look at all of that. With the, oops, sorry. I wanted to just go through. This is using a digital thermal imaging. And this was a dog that had cruciate disease and restrictions in the right iliopsoas. The red is heat uptake. So when we compare it to the rest of the body, we can see there was a significant amount of heat in the lumbar area, the pelvic area, more on the right side than the left side. And then if we look at that right side, because this dog was just curving a little bit more to the right as the vertebrae started to compensate a little bit more compensations there. So again, as the practitioner, you need to decide if this iliopsoas issue is a primary problem or if it's compensatory. And, primary, we definitely see. Secondary, things to consider. As I said, cruciate disease, hip dysplasia, internal causes, stenosis, lumbar transitional vertebrae, anything, else. Sometimes even bilateral elbow dysplasia, the dog will tighten up with bilateral iliopsoas restrictions. With an acute presentation, the dog will be partial or non-weight bearing on that affected hind limb. There is what I would consider severe to moderate pain at the musculotendinous junction, or where that iliopsoas is inserting into the lesser trochanter. If we look at this dog, this is Weasel, and she was an active whippet. We'll learn a little bit more about her, that got her right lower leg hooked up on the lure. So she is involved in lure coursing, and she had a hyperextension injury, and ultrasound confirmed an iliopsoas issue. So we'll see that decreased active and passive hip extension with internal rotation, as well as a painful lumbar region. Sometimes if dogs are super painful, non-weight bearing, they may have trouble defecating because it's difficult for the lumbar area to hold a contraction. So when we went back to that anatomy, when we look at the lumbar component, it is responsible for lumbar stabilization. When we look at the goals of our treatment, we always want to look at the multimodal approach. And as I mentioned, whatever your tool is that you like to use, Shockwave, photobiomodulation, manual, whatever we want to do, we need to work with the multimodal approach. So the first step is always finding the lesion. We never want to assume that it's an iliopsoas issue. We need to find it. Definitely define where it is. Then our goals are to reduce pain and inflammation. And this is where your tools will come in. And the tools can also be manual therapy, stretching. We'll talk about Shockwave and photobiomodulation. After that, we want to restore movement. And we can do that with joint mobilization, both to the lumbar and hip component, passive range of motion, active range of motion, a home program. So this is something that we want owners to really be compliant with, a nice home program. And then a key component to getting them back is that eccentric activity to return to function. So the beginning slide, I showed a dog going after a ball. That slowing down, or that eccentric contraction, we need to strengthen the limb up to be able to protect the area. So I mentioned this is Biscuit. She's a 5-year-old intact male. I'm sorry, this was another one. Biscuit was a different one than Weasel. So Biscuit is a 5-year-old intact male whippet, had an acute history of left hind limb lameness, very active with agility and racing in ovals. Very interesting. In the United States, all the dogs race in a counterclockwise position. This is not true in all the other countries. So not only did he present like this, he was reluctant to jump into the van, play with other dogs, defecate without moving. And as funny as it sounds, I always ask owners if the dog is defecating and moving. But have they always been like that? So if that's their norm, not a big deal. But if this is new to them, they may not be able to hold that position, again, that lumbar component, to be able to defecate and hold the position. So Biscuit also, while moving, had decreased range of motion in that left hip. Owner definitely said coming in, all the other dogs would run to her except Biscuit. He would just kind of stay in his bed and that was it. He was put on Robaxin or a muscle relaxant and NSAIDs. And when we looked at him, you can see here before that left hip is tucked under compared to the right. Definite pain up in the pelvic area along the iliac crest. And here, just palpating him, coming in and feeling him. Watch and pay attention to the lumbar region and just a little bit of reaction. And there we go, right at about L3, L4. So definitely some compensating. Where my thumb is on the left photo, this is where most of the pain was isolated. I also look for a square stand. So he is not standing squarely. He prefers to keep that left hind limb tucked under. So his clinical representation, he had repeated pain upon palpation to the left iliopsoas and the left lumbar region. His hip extension was decreased by 10 degrees, 150 degrees on the left compared to the right at 160. He also had a decrease in thigh muscle mass by 2 centimeters. And at the time that we took these measurements, this injury was 2 weeks old. So, was all that muscle loss from the injury? Not positive, but 2 centimeters was something to pay attention to. And then on a dynamic gait analysis, he had decreased extension on the left hind limb. It was 48 centimeters compared to the right at 56 centimeters. So that was a pretty significant objective measurement right there. So our treatment goals, of course, we wanted to decrease pain and inflammation. And we wanted to look at the origin and the insertion of the iliopsoas, so both components. Improve his range of motion. So even though we did not measure the lumbar extension and we have a whippet or an arch top line, he wasn't able to extend, even put his forelimbs up on the ottoman at home of the owner. So we were using that as an objective measurement. We wanted to improve his strength, and we would look at that with both thigh circumference measurements as well as the dynamic gait analysis, begin eccentric strength, and also return him to the previous levels of activities. The owner wanted to get him back to racing as well as agility, but more important, the goal was to get him playing with the other dogs in the backyard. So they have 5 whippets all together, and that was one of his favorite things to do. So initially treated with pulse shockwave therapy, looking at the lumbar region. The goal definitely to decrease that lumbar pain, and pulse shockwave is probably my favorite tool, if you will, to go to for soft tissue lesions. I love photobiomodulation as well, but pulse shockwave really assists with reducing the soreness, and it doesn't take too many visits there. The lumbar component, we are treating L2 through L7, sometimes moving up to T13, L1, and moving down into the pelvic region. We also want to treat the iliopsoas region. So this will involve the insertion of the iliopsoas. And I like to think about beginning in neutral and then starting to stretch into extension, whether you're utilizing a shockwave or photobiomodulation. And I'll have a slide to explain that a little bit more too. With joint mobilization, one of the things that I have found works very nicely is to mobilize the ilium of the affected side. And we are doing this from a dorsal to ventral glide. And if you watch, my thumb is located over the left iliac crest, and then my thenar eminence is applying a dorsal to ventral glide. The glides are performed at a rate of anywhere from 25 to 30 glides per minute for up to 3 minutes. And this is very relaxing for the dog. It turns off the muscle spasms in the area. So it's lovely that we have that and can just turn it off. And I'll show you that one more time. So again, my thenar eminence, or this part of my hand, is over the iliac crest, and I'm applying a dorsal to ventral glide. So from the top down. Another thing that we want to look at is the joint mobility, certainly of L2 through L7. As I mentioned, a lot of times the left side is more restricted. So you want to decide which side needs more mobilization. But this will be, again, a dorsal to ventral movement down. You can see where my thumb is. And the goal of mobilizations is to decrease pain and improve the range of motion. My right hand is applying the mobilizations. My left hand is just feeling for any pain or discomfort. So getting in on manually and working with these guys is very important. And joint mobilization is more of a specific treatment. So that's something that that is takes a little bit more, but something that I highly recommend. Massage, manual therapy, even I've started doing some cupping with the dogs to help increase the fascial mobility, and that's been wonderful. So looking at once we've decreased the pain, we want to start working, follow it up with that passive motion, then active motion, and then think about what the owner can do at home. So performing the passive hip extension, we're just slowly bringing the leg back. Notice I'm supporting the hip, and I'm stopping when the dog feels any sort of resistance. This is done after a little bit of a warm-up, which can be, just walking around 5-10 minutes, could be in the underwater treadmill or doing any core work, anything like that. Then we always want this to be followed with active range of motion. So following with the active range of motion, we can think about putting the front paws up on something. In the case of Biscuit, our goal was to get his front legs up on the ottoman. We can also walk over the cavalettes. We can do sit to stands, and then think, after you've done this, what you want the owner to do at home. So this will be very important that you're having that owner assist the dog. So working on, various things. So front paws up, can they walk over objects at home? Just picking out what is best to do. There we go. So this is after one treatment, and notice how much he's standing. Still not perfect. He has that left hind limb still turned out, but much better than when we started. And ideally, you should see these improvements pretty quickly. So he got back. It took him 3 months of rehab where he started, he was coming in twice a week for the first couple of weeks, getting treated with both Shockwave, Mobilization. I think he had 4 Shockwave treatments. Then we started to work with photobiomodulation. He went from twice a week to once a week for about 6 weeks. Then we decreased to every other week and started working him in the underwater treadmill and with eccentric activity, which I'll show you examples of that. His home program, and I love the Assisi loop with these guys as well. So passive range of motion, I trusted his owner to stretch. Active range of motion, we started specific exercise for strengthening, and just beginning with core strengthening is key. So that if we start to work on that lumbar component will be very important. And then utilizing the Assisi loop, both for the iliopsoas and the lumbar region. So with Biscuit, I had the owners just put his leg through it. So we were getting that iliopsoas component and the lumbar component with the depth of the Assisi loop and what it's able to treat. So here, just if you cannot get it through the dog's leg, you can definitely lie it on the hip region or lie it on the lumbar region. Again, when we look at the depth of penetration and what I call that cone, we will just lying it on the lumbar region will be of great benefit for the iliopsoas, or putting it around their hip. And I like to have owners start with this 2 or 3 times a day, then decrease to twice a day, then once a day. So, but a very important component of the home program. Mentioned joint mobilization, and this is something that if you're interested in learning more about, we offer a program. It's now through NC State and Northeast seminars, but definitely working on restoring that passive movement. That is crucial to get all of that range of motion back, as well as that strength. And if you notice on this girl, I have her forelimbs elevated slightly. So she's in a slight extended position. So this is allowing me to get a little bit more motion there. So it's nice to put it up there. As I mentioned, that functional position, just treating in that functional position is fantastic to work with that. Just looking at some of the questions. So forelimbs up, we can begin to elongate that iliopsoas area and the lumbar component. This was a show dog that injured her iliopsoas while running around and playing. So that happened. And this is what I mean by treating in a functional position. So with this dog, we can see that the hip is up into extension, and the lumbar area is in extension. We are on an unstable surface, and it opens up or, just allows access to that iliopsoas and to get in there. The same time we're stretching, and in this case, doing a little bit of core work at the same time. So this is something so important to think about. After when initially starting, we may have to use more of our modalities in our manual work. So again, thinking about whether you're using Shockwave, photobiomodulation, the Assisi loop, if it's a larger dog using the Assisi lounge, your manual therapies, you may need to do more of that initially. Then as the dog starts to improve, we're going to do less of that and more stretching and therapeutic exercise. But always think when we are done with our modalities, we're going to follow that up with active motion. So thinking about how to elongate that area, strengthen that area, and then the home program. So I always like to keep my home programs to 2 or 3 exercises, and these are switched up usually every visit. And the goal of the active motion will be to improve hip extension and lumbar extension, and definitely work on that core strength. Again, thinking about that lumbar component, that core strength is very, very important. So, we can start low-level core strength very early on. And when we think about the core, so core work needs to be performed. So just looking at where that iliopsoas starts at in the red, you can forget about everything else there. But we look at that relationship of the iliopsoas and the spine to the axial skeleton. That relationship is crucial. And damage to the iliopsoas affects the dog in both open and a closed chain. And an open and closed chain, meaning closed chain is when the feet are on the ground, and open chain is when the dog is jumping, such in dock diving or something like that. So it is active in both types of motions. And core work is just going to continue to emphasize that spinal and hind limb strength. My little Brussels Griffon puppy is making his guest appearance here. This website here emphasizes how important the spinal and hind limb strength is with core work. So just to think about that. And when we look at core work, so I like to start with the forelimbs elevated. This is on a disc. The hind limbs are down. So we're starting to get some core strength, as well as, of course, forelimb strength and hind limb strength. And I'm asking the dog just to lean forward a little bit. And I want to maintain a flat top line, and this will help maintain or work that lumbar region. And we'll see here, as the dog is just leaning forward a little bit, we're getting that core strength, but we're also starting a little bit of eccentric strength. So that leaning forward in baby steps. If we think about, again, when a dog is chasing a ball or a squirrel, they're going to lean forward and stop. So I'll play the video again, just so you can see. And we're using like string tube peanut butter or something to ask the dog to lean forward. And this dog was very active in fly ball and injured her left iliopsoas. We can also work on core work with a balance disc or a wobble board. So this also forelimbs up, front legs up, the back legs on the ground. We're keeping a flat level top line and challenging the hind limb. Signs of fatigue will be if the dog is moving one of their hind limbs, or of course sits down. The German Shepherd here is more of an active dog and involved in Schutzhund, and you can see his program is a little bit more advanced than the Clumber Spaniels. So he is on 2 unstable surfaces. We're really working that core as well as the iliopsoas area. Anytime the forelimbs are elevated, there's more weight onto the hind limbs. Another version of core work, the dog's hind limbs are elevated, and we're just asking her to lean forward. And you can notice this takes a little bit of work. It's a lot of eccentric strength. We're looking for that top line to remain, but also, as I play it again, watch how much the abdominals are working as well as the legs. So we really see a lot of that lumbar component as well as the abdominal area. And we can also work on having a dog sit on a disc or a dog bed or something unstable and hold a tight sit. While they're holding that tight sit, this will contract the pelvic musculature and assist also with that core strength. Very often in iliopsoas issue, the dogs may not be able to hold a tight sit because hip flexion and stifle flexion is painful. We can also see this issue with cruciate tears as well. Sitting core strength, very important. Just as I mentioned, here's just another video of the dog sitting and us telling him he's a good boy. This is a hunting dog and also had an iliopsoas issue confirmed by ultrasound. So we're having him sit, and this is something that the owner does at home, and working on the core strength. If the dog can catch, you can certainly throw some pieces of kibble or low-calorie treats for the dog to catch, and that will make it more of a dynamic activity. Walking on unstable surfaces is great. This will challenge balance, proprioception. This is a floating dock, and those work great. If I have had owners take their dogs out on a boat or a kayak, but that balance work there will work the core. It is also great for ligamentous issues. So, something else to think about. Sometimes children's playgrounds have swings that you could walk over, kind of like a swing bridge. Those are great also. And I always like to incorporate this into any dog's workout, but specifically dogs with iliopsoas issues or cruciate issues, because it helps with the training of balance, proprioception, and helps with ligamentous issues. I mentioned that eccentric activity. Now, this is the same dog with fly ball, and now we have her hind limb elevated a little bit. So think back to that image of the dog catching the ball where the hind limb was up. So with this, the dog's hind limb is elevated, and we have her leaning forward. So starting to elongate that iliopsoas a little bit more, and just starting maybe leaning forward an inch or two and then returning. When the dog starts to show sign of fatigues, we are going to take a break. Signs of fatigue may be sitting down, the injured leg kicking out or turning out or picking up. So rather than give a number, do 3 sets of 10, I'd much rather work with quality over quantity. This was a very high level field trial dog, and this is a slow motion video. And we're working on him leaning forward eccentrically. So this is a very high up ranked dog. And what we're doing is just having him lean forward for some peanut butter. And what I noticed with this is certainly the iliopsoas and the lumbar component were huge, but look at how the rest of his body is working to control the area. So we have so many contractions going on with the hamstrings, the abdominals, the tail is working to assist with balance. So much going on here. And this is very advanced. Our goal with him was to get him back to the field. And part of his program was to start functional training. So we would go out in the field by our clinic and start throwing bumpers. I was going to say fake ducks, bumpers, and just working with, maybe having him go 100 feet, repeating that 7 or 8 times, giving him a couple of days off, and then repeating. This is another way of working the iliopsoas, having the dog on a foam roller, and just a little bit of movement there will engage the iliopsoas as well as the lower abdomen. So you can see the dog picked up her left leg and just showing some signs of fatigue. So again, using a roller and working on that. And ideally, I would like to see both hind limbs equal and on this, but you can see she's favoring that left side. Again, another high-end dog at the end of rehab, just leaning forward there. And I'm not pulling, I'm just making sure he doesn't slip. I also want to feel if he wants to move forward. And we can see on that left, he wants to pull forward. He had a history of a left iliopsoas issue. So with working with eccentric strength, I recommend doing this every other day. And we want to watch for soreness. This is where the soreness may develop. For example, walking upstairs, we may think is more difficult, but coming downstairs actually puts more stress on the muscles because it's causing an elongation. Underwater treadmill is great. I like to start with acute cases with the water up above or just at or below the greater trochanter, depending upon the dog. But beginning very slow, and then you progress as needed to build up both strength and endurance. And this is the field trial dog moving along here, holding his bumper. And this again was at the tail end of his rehab. So he would go for about 30 minutes. We would start at 2 miles an hour. He'd get up to 4 to 5 miles an hour and then cool back down at 2 miles an hour. And we progress to the level of the water at the stifle or the knee height. So I mentioned the Assisi loop, couple types of positioning again, of where you want to put it. But I think this is a key component with the success in treating these iliopsoas conditions. I'd love to say that these dogs are going to come into the clinic twice a week. We know that doesn't always happen. So doing something at home to treat that pain, that inflammation, and then certainly working with a home program. So I always take pictures of how to position the Assisi loop for the owner so they have it and they know what they're doing there. So just in summary, when we look at the treatment of iliopsoas injuries, we want to identify the lesion always. Don't assume. Again, there could be so many other things underlying. We want to definitely identify the severity. And this goes for everything, not only an iliopsoas injury, but if you cannot treat the lesion, or if you cannot identify the lesion, you cannot treat it, or you cannot treat the lesion if not identified. So if you don't know specifically what you're doing, what you're shockwaving, what you're utilizing photobiomodulation on, don't. You need to always identify what you're treating. Once that's done, then we can employ the multimodal approach. So again, reducing pain, reducing inflammation, reducing pain and inflammation, improving range of motion, improving strength and function. And one of the biggest mistakes I see is not treating these issues all the way or treating with a multimodal approach. As more and more general practices are obtaining lasers or some even shockwave units, they're treating with the modality, which is fantastic, but they're not incorporating the strengthening, the flexibility, and the return to function. So that's often the missing component. Eccentric strength is necessary, whether you're taking that dog back to high-level field trials or that dog is going to chase a squirrel a couple times a week. We need to prepare the dog for what they're about to do. Home exercise program, think about pain and inflammation reduction, passive range of motion, active range of motion, and strengthening. And here, just some examples of passive range of motion, active range of motion. So depending upon what the owner feels comfortable, I may not have them do hands-on. They may just be doing something like asking their dog to put their front legs up on a step or a disc in this case. Hill work, walking up hills is great to strengthen the hamstrings for the iliopsoas. We just want to be careful when the dog is walking down. I will recommend zigzagging so there's not stress on the iliopsoas. Core work is essential. Also, just regular walking. As long as the dog is not lame, regular walking is fantastic. And many owners do need to be educated in what a quality walk is like compared to maybe not such a quality walk. So again, looking at that multimodal approach, short and long-term goals. And each dog is going to have those individual goals. So there's no cookbook approach to anything. So certainly an athletic dog with an iliopsoas injury versus a couch potato are going to be addressed differently. The athletic dog will probably need more work. And that's, just the way it is. The couch potato may need more work also because they may have other issues or be dealing with weight issues as well.